I'm not sure PAs in general really understand how we get paid, okay? What drives our healthcare system is the level of service code when we see patients. It's by the number of patients we see, which is called the level of service, the E&M code. So the more often we see patients, the more we get paid, obviously. So there isn't really an incentive to keep people healthy if you want them to keep coming back to see more and more patients. And then secondly, it's driven by how much we can charge for the procedures that we do, the CPT codes. The people who are the workhorses of our healthcare system, the family practice physicians and the primary care physicians, get paid the least, even for the same CPT codes in this country. For example, earwax removal done by a primary care physician or PA gets reimbursed about $75. If an ear, nose, and throat doctor does that exact same procedure, no additional equipment, the exact same CPT code, they get 3 times as much money for doing that. Now, I don't mind that someone who went and did an extra year of residency gets paid a little bit more, maybe 10, 20% more for the same procedure, but not 3 times as much. Something is fundamentally wrong there. In this country right now, in terms of the reimbursement system, there is little, if any, relationship between what is charged to the patient, or what is billed, what is reimbursed by the insurance company, what is received, what the actual cost is to that healthcare enterprise, or clinic, or hospital, what have you, and what a patient would have to pay if they paid cash. No relationship whatsoever in general terms. And I'll give you an example. What really bothered me is a procedure I had personally myself was a balloon sinuplasty, okay? I saw an ENT who did a balloon sinuplasty in-office procedure on me. I sat in a chair in his office for approximately 15 minutes. He put the scope, balloon scope, in my nose, a rubber tube, pressed a button 4 times, which dilated the scope 9 millimeters for the 2 frontal sinuses and for the 2 maxillary sinuses. 10 seconds, 10 seconds, 10 seconds, 10 seconds. His PA stood there with a tissue in case I got a runny nose, a bloody nose, excuse me. He billed Humana Insurance $36,000 for that 15-minute procedure, okay? Humana turned around and reimbursed him $12,000 for that 15-minute procedure. And I know he does 10 of these procedures per week. He advertises on the radio, he goes on all the morning talk shows, he does talks at a hotel across the street every Saturday to get people interested in solving non-invasively their chronic sinus problems. And so 10 of these a week at $12,000 comes out to over $6 million that this physician is making on Tuesdays alone. The PA who stood there holding the tissue in case I got a nosebleed was billed $3,000 and was reimbursed $1,000, okay? I think if the PA knew that he was making $10,000 off of her services every Tuesday, she'd probably ask for a raise, okay? And then I contrast that with the $42.88 that I received as a PA, which was 10%, that was the Medicaid payment for seeing Medicaid patients in Wisconsin. It would be 10% more if I were the physician, so add $4 for that, say $52, or no, $45, let's say, that a family practice physician would get for seeing a patient a 99203 or a 99214. And is expected to know everything under the sun about their medical problems, spend lots of time with the patient, following up with phone calls and lab tests, and trying to find inexpensive medications for them. You know, these are the ones who are really doing the work of our healthcare system, and they're getting $50 per patient. I ran a clinic where I charged $50 cash for patients who had no insurance. And when I compared that to the $36,000 that this guy was charging and the $12,000 that he received, I got extremely discouraged. And that's what's motivating me to speak out about this discrepancy and disparity that we have in our healthcare payment system in this country, and how it's ruined, really, it's really ruined and corrupted our healthcare system. In my opinion, it was insulting to me as a PA to have this fellow get over a month and a half's worth of my PA salary in a 15-minute procedure that was not difficult, where the equipment wasn't that expensive, and that anyone could learn how to do. So that really was the straw that really got me motivated to do this. And it emphasizes and it really reveals the discrepancies that we have. And in his billing, he billed 36, got 12. The actual cost to him was probably much less. And I have no clue what he would charge to somebody who didn't have any insurance at all. How can you in good ethical faith charge somebody $36,000 without insurance for that 15-minute procedure? Number one, our unjust reimbursement system is an encouragement for fraud. And we need to realize that and recognize that. And number two, and this is really close to my heart, we need to remember where we came from as PAs. The PA profession was founded by Dr. Stead back in the 1960s to meet the medical care needs of people who didn't have access to health care in rural, medically underserved areas and inner city areas where physicians didn't want to work, where there was a shortage. We were out there to help people who had no insurance and little access to health care. And when I look at where we are now more part of the problem of this unjust healthcare system and unjust reimbursement system. We're part of it now. We're part of the problem now, rather than part of the solution. We were intended to be part of the solution, and now, unfortunately, I think we've really swung and become gobbled up into the system, not even of our own choice. That's where the jobs are. An orthopedic surgeon can afford to hire 3 PAs, to help him. A family practice physician can barely afford to hire 1. So the jobs are where the money is, and the money is with the specialists. The healthcare system needs to change, where the primary care physicians get increased reimbursement for keeping people healthy, and the specialist reimbursement definitely needs to come down.